Good morning and welcome to The Point. It is Wednesday, November 25th, 2020. Thank you to those of you on the GBN Grenada Broadcasting Network's Facebook page, the Grenada Broadcasting Network's YouTube channel, the website www.gbn.gd, GBN TV channel 7, 11 and 20, and good morning to the listeners of Classic 105.5, 105.9. We're going to get right into the discussion. This morning we have joining us is Minister of Health, Honorable Nickolas Steele. I guess I can call him a co-host by now because we've facilitated him so much in the past few months, especially as COVID-19 has taken its toll on Grenada and the rest of the world. Good morning once again, Minister.
Good morning, Blossom, and good morning to all of your viewers and listeners. Indeed, as always, a pleasure to be with you.
Thank you very much. The first thing I'm going to ask about is in relation to the breach in entry protocols, I'd call it, from the yachters in St. David on Monday, God willing. I know they have been in quarantine as well as some Grenadians. What's the update, the latest tests carried out, results, so on?
But the individuals remain in quarantine. As you know, we test on day 4. So we will wait for that time period and then test. And then based on that, we will have an announcement either that everything is all clear or, God forbid, that there are some issues to be dealt with.
So far, are they showing any symptoms of the virus?
No, I have no reports of anyone showing any symptoms.
And yesterday in Postcard, we pointed out there were 10 Grenadians, 10 locals that have been placed in quarantine. Have any of them showing symptoms?
No, and it would be extremely out of the ordinary for any of them, even if they were infected, for them to be showing any effects or so as yet. It would be somewhere around day 3 or day 4, if at all, that they would show symptoms.
When the incident happened, the talk on the ground was that they tried to evade our entry protocols. But as the acting CMO, Dr. Charles, explained yesterday that it was a misunderstanding. What has led to the conclusion that it was a misunderstanding and not a deliberate attempt to breach the country's entry protocols?
Well, I have to rely on the information from the RGPF, etc., and just the circumstances of the situation. They came in to what was previously an official port, didn't hide the fact that they had come straight from and actually were seeking to be cleared. So they came in, and the information I have is that they were inquiring, where do we go to do our clearance? Assuming that it was there at St. David's. And it was then that they were told, no, it is not here. There are only 2 ports in which you can clear in or clear out. And we're in the process of going back to that port when they ran into some difficulties.
And as part of the post-cab briefing yesterday, you pointed out that you expect there to be an increase in the frequency in which people may try to breach the entry protocols, and in that vein, the ministry is stepping up its surveillance of our ports. You pointed out PT Martinique as one of the potential points that we'll be stepping up protocols on, and the next port slipped my mind. But with those 2 other intentions of increasing from those 2 additional points, or that's where we're going to stick for the time being?
Well, 2 things. One, there's a general increase. What I was speaking to was the increase of a presence on the ground in Petit Martinique. And this came at the request of persons in Petit Martinique, as well as reports coming out, Petit Martinique being one of our northernmost point and accessible to anyone coming from the north. So it was felt that we should put some more individuals on the ground there to observe, to prevent any possible breaches or to report any suspicious activity. But the Coast Guard in general has increased their patrols and their level of due diligence throughout the island as best as possible.
And that's another comment I've heard from the public, that we do not have enough sea patrols from the Coast Guard. Is it adequate to monitor the entire circumference of the islands, including Carriacou and Petit Martinique, with the resources that the Coast Guard has?
Well, I think like anything else for us in a developing country, including in healthcare, we would love to have a lot more resources. I'm sure that the Coast Guard, and I'm not trying to be facetious, would love to have access to helicopter or drones or additional boats or so, but we have to use what resources we can afford to the best of our abilities.
And before we get into the Christmas protocols, something that I wanted to, I can't remember if I heard it in Postcab yesterday, in relation to the vaccine. I know there's a process to go through, and we get our directive really from the WHO, but the question that a lot of people have asked is, have asked, would it be mandatory to take the vaccine if and when it does become available in Grenada?
At this point, a decision hasn't been made on that. It's a discussion that's being had here at the ministry. It's a discussion that will be held tomorrow with all of the CARICOM health ministers. It's a discussion that's being had in most countries as well. I have not heard any country as yet saying that it would be mandatory. I have heard announcements of certain airlines saying that it would be mandatory to board a flight, as well as certain countries saying it would be mandatory for someone entering to have the vaccine. But in terms of a national program for vaccination, that has not been decided upon.
What will be some of the factors that would determine Grenada's stance if it would be mandatory or optional? What are some of the things we're looking at?
Our position would be to make it available for all frontline workers and persons at risk. So persons with comorbidities or existing conditions that put them at a high risk for COVID-19, as well as hospitality sector workers, to make it available to all. So as to whether it will be a compulsory or not, I think government has to have discussions with the unions and Ministry of Health personnel, etc., as to how we would implement this, and it has to be a joint collective decision in which common sense would prevail either way, whichever way we decide.
All right, let's get into the nitty-gritty of Christmas 2020. Christmas with a difference. It won't be business as usual for citizens, as well as the people who would usually put on events. A meeting was held with promoters, entertainment promoters last week. Could you just highlight some of the things that were discussed in that meeting? What were some of the decisions taken and the concerns the ministry expressed that the entertainers need to be mindful of?
I think our objective was to try and find some sort of mechanism for them to understand, and a criteria and application and a timeline to make this as seamless as possible. But also, what we don't want to get lost in our efforts to engage and try and find some sort of happy medium, we don't want it to be lost that nowhere in the world is there going to be the ability to have a Christmas like last year with respect to gatherings, etc. Most countries in the world are still on some form of restriction or lockdown completely. And we in Grenada have to recognize that we have the same threats. COVID is still just as much alive and kicking out there. And the risk to our country is even greater now than it was earlier in this pandemic.
What do members of the public need to be mindful of? While the entertainers have their part to play, the greater part of the country are just, for lack of a better phrase, ordinary citizens, and we usually do things, spend time with family, Lime, Christmas Eve. Of course, I know there may not be major events for Old Year's Night into New Year's. What do members of the public need to keep in mind as we go about the next few weeks?
Large gatherings put you at risk. Large gatherings in which you're in close confined space or close proximity to many individuals put you at risk. And as individuals, we need to minimize our risk, and therefore minimize the attendance possibility of us being at such gatherings. And if it is necessary for us to do so, then to make sure that you practice hand sanitizing, physical distancing, wearing of masks, etc. I think we need to ask that question: what is necessary, whether it is during the Christmas season or any other time, and what is something that we can possibly forego, with the understanding that these aren't normal times. It is a war that we're fighting. In this war, there are no bullets and bombs being dropped. But if there were bullets and bombs being dropped, would we be looking to have these large gatherings? Would we be saying, well, we're still going to go and have Christmas lunch or Christmas parties, etc.? Or would we be saying, no, there's a risk? Because this enemy is invisible, doesn't make the risk any less. It just, in some instances, for some of us, it allows us to sometimes either ignore the risk or not fully contemplate the risk.
What would you say to the people, family members who say, you know what, everybody in my family, we've been in Greens for the past months, nobody has traveled, all of us could come together, 22 of us, not even 20, 22 of us can come together in one household. What advice would you give to a large family who wants to fit and celebrate?
I would say that no family is invincible, and there's no way that we can guarantee that because we've all been in Greens for this time that we're all safe. None of us are immune. There is no vaccine as yet, and as such, it's a case of whether we're prepared to take that risk or not, whether we're prepared to run the risk that that family gathering would be what could infect some or many or all of our family members, whether it's worth it, or whether we can find other ways to express our love, share our appreciation for getting through this year and celebrate the birth of Christ.
Before I take the break, I just wanted to briefly ask about dengue as well. I know that continues to be a major concern of the ministry, and I saw a report that said so far for 2020 we've doubled the amount of cases that we recorded in 2019. Is that so?
We are much higher in 2020 than 2019. 2018 was one of the years, the highest years on record. We haven't crossed that as yet. I do hope that we do not cross that. 2020 has had more rainfall and more extended rainfall than 2019, and that's one of the factors because it is a vector-borne disease. But I would say, and we shouldn't use this to find a level of complacency or comfort, but that it is not out of control. We are still managing to control dengue, but we are still seeing cases of dengue. And in our opinion, one case is one case too many, because any one of those cases could end up with some hospitalization or death. So we need to work together to get to zero. That's going to be done with us accepting the collective responsibility and getting past the rest of the rainy season into the dry season where the mosquitoes in general stop breeding.
Do you have any figures at all about maybe how many we've recorded for 2020 or maybe how many in the last week or month or so? Any figures at all as it relates to dengue cases?
We'll be able to get that before we come off air.
Okay, no problem. In the meantime, we're going to take a break and then we're going to come back and continue the discussion. Minister of Health Nickolas Steele, COVID-19, dengue fever. We'll be right back to the point.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
Feel good tax.
Remember, if you have flu symptoms, do the right thing and stay at home to avoid giving it to others. Remember, you can be infectious up to a week after developing symptoms, so rest up and take it easy.
Stop the spread of germs that can make you and others sick. Cover your nose and mouth with a tissue when you cough or sneeze. If you don't have a tissue, use your elbow. Wash hands often, especially after coughing or sneezing into a tissue.
No, that's not how you cross the pedestrian crossing.
Really? One day I just woke up and I saw pedestrian crosswalks on the road. No one really showed me how to use them properly.
Well, this is how it's done. You never cross before doing these things. They might save your life. First, when you get to the crosswalk, you stop. You look left, you look right. If there's a vehicle coming, you put your hand out, making eye contact with the driver, indicating that you...
Welcome back to The Point, speaking with Minister of Health, Nickolas Steele. Minister, before we took the break, you were looking for the figures as it relates to our dengue cases for 2020 so far.
Yes, for 2020 so far, we've had 318 cases of dengue. In the last reporting week, which was week 46 of the year, we had 46 cases reported. And just to put things into perspective, in 2018, we had a total of 387 cases of dengue on the island. In 2019, we had a total of 148 cases of dengue on the island. And in 2020 to date, we have 318. So we haven't gotten to the level as in 2018. However, based on the current trend, it's quite possible that, yes, we would surpass the 2018 high of dengue. We're seeing that with other OECS islands as well. Because it's an unusually high and extended rainy season. And as such, the mosquitoes are breeding more. So we still need to be very cautious of it until we get past our rainy season.
Have you recorded any dengue-related deaths so far for the year?
I do not have any of that on record of any dengue-related deaths for the year. No.
All right, that's good news. At this point, we're going to open the phone lines and the platforms for our viewers and listeners who may have questions for Minister Steele. The phones have been ringing since the program started. The landline 435-2041. The WhatsApp, it's also 435-2041. Please, only written comments on the WhatsApp. And you can also participate and post your comments, questions, queries, concerns on the GBN Grenada Broadcasting Network's Facebook page and the Grenada Broadcasting Network's YouTube channel. And please continue to keep it respectful. Let's go to our first caller. Good morning, caller.
Good morning, Auntie Blossom.
Morning, Ms. Jacob.
How are you?
I'm good.
Right. Good morning to my wonderful, handsome, beautiful minister. Good morning, Minister Steele.
Ms. Jacob, you're making me blush. Good morning to you. Good morning to you.
I'm making you what?
Blush. You're making me blush.
Well, you have to blush. because he's my wonderful, handsome minister of, what you say, health, you know. Ay, ay, ay. I come in with you the health. And you know what I want next year if I live to see? Our visiting station in Pitibak, in Wester Hall, visiting station. I want you to put an addition on it for me. And you know what I want? If you could get somebody to give us a bush shed. Because you know some of those senior citizens, like me so, although I could run, but Yahuda can't run. When the rain falling, had to go quite down either by food land and no way to shelter, and the visiting station so small. If you could add in a little piece, some not much. I don't asking for plenty. If you could do it plenty, you do it. But you go put add a little piece, and you go put on a veranda in it for us, and God going to bless you more again. I'm praying a lot for you all.
Thank you, Ms. Jacob.
Minister Steele, you have a wonderful and a blessed day. Auntie, just take care of me, Minister, Day for me, please. I don't let no fly touch it, eh?
I will, Ms. Jacob. Thank you.
Okay.
All right. Love.
Bye-bye.
Any response, Minister?
What can I say? I wish Miss Jacob long life, health, and happiness. I will speak to Minister Joseph as well to see how we can make sure and organize as best as possible the request you made.
All right. Somebody on Facebook is asking, if all the positive COVID-19 cases are in quarantine, what is the risk now? Is it to create fear?
No, it is not. And it is all of the cases that we have captured at the border are in quarantine. We continue to say that the Ministry of Health, RGPF, Government of Grenada, Customs, everybody, Coast Guard, we are not perfect. And there is always a possibility, as we have admitted in the past with case 25 and case 31 and 32, that people breach the quarantine. People escape out of the best and most expensive maximum security prisons. The arrangements we have with quarantine here rely on the individual's better judgment as well. And we have seen that some people do not exercise that good judgment. And as such, we need to have this additional level of caution, of defense. We've seen that every single country in the world that did not have this level of defense or extra caution is in trouble. Why should we think that we are any exception? It's the same disease, it spreads the same way, and human beings are human beings, and they will have some individuals that will take our safety for granted, and as such may breach and go to one of these parties that we're trying to have, or large events also that we're trying to have, and end up infecting us all.
Well, let's go back to the landline. Good morning, caller.
Good morning, Blossom, and good morning, Mr. Steele. Mr. Steele, as a concerned citizen, I'm calling concerning the Monkridge Medical Station. It's going on 3 years now. We have not had any nurse, doctor. It's closed down. If we have to go, we have to get a bus, go to Hermitage or to Sotes. This is unfair for the community of Monkridge, Montrule, and other surroundings. I would like for you to do something, please, for this medical station. If we haven't got a $5, we cannot go nowhere. According to our complaint, we could go to Snail Hall, to the Monkridge Medical Station. People from Snail Hall could walk up. People from Montrule could walk down as well. Why are they doing us that?
Thank you. Thank you.
Over time. And Blossom, you know, are always complaining. That was not what we had told when they was closing it. They said they're closing it for repair. Come on, it's overtime.
Thank
and
you
know things hard now, Mr. Steele, where we could walk to go there. help us out, please. Thank you. Have a blessed day.
Thank you, caller.
Let me be the first to say that the caller is not the only one that has been very outspoken on that. The parliamentary representative up there has also been extremely outspoken. I think we need to begin to contemplate that, and it's not necessarily the case of Montbridge. What we have found is, from the ministry standpoint, the number of health facilities in some cases is unsustainable. Montbridge was closed because it was not being upkept well, it was falling apart. And it was closed to be repaired, and the caller is right. When we closed it, we did close it to repair and to reopen. The funds for that and the project is starting with all of the various health centers. And I truly do hope that we can open Montbridge very quickly and keep that promise to the people. But I think what we need to understand, because she's called two other, so there's 3 health centers in that area. And then moving forward, we are going to have to make a decision as to having less health centers, but having them properly run, manned, and maintained, than trying to just simply tick a box and say we have a health center in Montbridge and we have a health center in Stan Hall, or we have a health center in as many places as possible. Making sure that we have health centers in the proximity to be able to deal, and that they can be open 24 hours, that they will all have ambulances stationed at them, and they will all have the ability to stabilize and deal with the community. Having buildings all over the place that aren't manned properly every day of the week is not the route to go. And that was what was happening as well with Montbridge, and reopening it in terms of the number of nurses, number of doctors being able to attend, and the type of facilities or services to be offered has to be questioned. So the caller, while the caller would like to see Montbridge reopen, I think the bigger issue is to make sure that our health centers throughout the island, if we have to consider less of them, but to make sure that where they are, that they are manned 24 hours, properly equipped, and offer more services. So more services in less health centers is, I think, the way that we have to begin to contemplate and go. That doesn't necessarily mean that is Montbridge closing, but it does mean that we need to contemplate some of our health centers, at least in the short term, would have to close to make sure that we take a more strategic approach to it.
I have 2 questions on the Facebook in relation to Carriacou. One asks, when are the people of Carriacou and Petit Martinique getting their ventilator? And another asks, is there any x-ray done on the island of Carriacou, or can x-rays be done in Carriacou?
Right, no x-rays are on the way to Carriacou. The work is being done, and as soon as the work is finished, that is the renovations for Princess Royal, the x-ray will be put in Carriacou. In terms of ventilator, I am not seeing the need, necessity, or practicality, more appropriately, of having a ventilator in Carriacou. A ventilator is a specialized bit of equipment. It does need a specialist doctor to use it. It is not something that is used that frequently, and is only right now present at the General Hospital. That is for intensive care. I know that a person is probably asking, because we are very much aware with COVID-19, there is the risk or possibility of persons needing to be ventilated or go onto a ventilator, intubated, and as such, those individuals are transferred to the ICU or the COVID wing. In the beginning, if somebody just showed mild symptoms or so, there is an isolation section at Princess Royal. But once an individual would need more serious attention or care, they would be transferred to Grenada. It's a case of a combination of doctors and nurses, etc., that are needed. It's the same in most other countries. There would be larger hospitals that would be dealing with the intensive care, and not the smaller satellite hospitals.
Let me take this landline call and then I'll get back to WhatsApp. Good morning, caller.
Good morning, Blossom, and morning to the Minister. Minister Steele, I live at Circular Drive at Grandans, and as the back, like up to the mountain side, a lot of houses went up there. No, there is absolutely no drainage system. On a constant basis, like on a daily basis, and especially when the rain falls, is a lot of mud, debris, everything comes down, and it builds up a drain. The drain at the front of my house is always full of mud and debris. I am tired of cleaning and paying to clean, and I think the problem has to be solved because somebody from the ministry came and then I didn't hear from him again, but nobody has any, so all the water just comes down that mountain. And I really wish something can be done about it so to alleviate the problem, because besides that, the water is stagnant in the drain, so you could imagine mosquitoes breeding and that sort of thing. So please, if you can maybe send someone and do something. I think the drain at the front of my house is just flat, so everything just settles. If it was sort of tilted a bit, the water could have just run off and go its way. But I've almost 2 years now been complaining about this problem. I don't know if you heard, but I left numerous messages at your office. So thank you, sir, and have a good day.
Thank you, caller.
Right, Dan, yes, we did, and Minister Cox in our last town hall meeting last week had said that, yes, they are addressing as best as possible some of the drainage issues that are leading to flooding and so in the south. With respect to Circular Drive and the pooling of water there causing mosquitoes, I can have the Ministry of Health address that this week to see if we can prevent some of the pooling, but the major work of drains and so has to be done in a phased manner. Development sometimes goes on unplanned, as you alluded to, on the hillsides, and government has to find that medium between assisting the individuals who need housing, where it is government land, and making sure that they do it properly, if not that they are moved and placed somewhere else, and also to deal with the overall development that's causing not just drains being clogged, but flooding throughout the south. So it is being addressed. It is a difficult task, not an impossible task, and not one that we're going to give up on. And we will take it case by case. Work was done recently in Circular Drive, not in your area, but in another area that needed to be addressed, and work continues to be done throughout the constituency to address. It's not a case of anyone being ignored. It's a case of trying to do as much as possible in all of the areas. So we will come around and deal with the mosquito issue, and then try and deal with the additional drains also needed in that area as soon as possible.
While we're on the south, let me ask a question again about the constituency. There's a video that's circulated on social media late last week into the weekend of a mentally unstable man hoarding garbage. Have you seen it, and what can be done?
I saw that video, and I expect to get some information later on today as to addressing the issue, because it's a public health issue as well as a mental health issue with the individual. Both of them fall squarely with the Ministry of Health. We don't collect garbage, but we cannot allow garbage to be accumulated like that. And it's in my constituency. So it rests squarely in my hands to address.
All right. WhatsApp. Somebody on WhatsApp is asking, in relation to the vaccine, since the best vaccine so far is only 95% effective, does that mean 5 out of every 100 people vaccinated can still contract and spread COVID-19? And also, is it possible for an effectively vaccinated person to still spread the virus to others? In other words, can vaccinated people simply be asymptomatic or healthy carriers?
For 95% effective is quite high. It's where many other vaccines are. It's where some of our tests that we use, that's in the same percentile of accuracy or effectiveness. Is it possible for somebody to be vaccinated and still catch COVID-19? Based on the information, yes, there's a 5% chance that somebody could still catch the disease. But if you have mass vaccination, the possibility of somebody catching disease does exist, but the possibility of that causing widespread infection throughout the community is minimal, if not zero, because there are only 5% of the rest of people around would have the possibility of catching it from that person. So there's a buffer around us all. The same exists with influenza, with H1N1, the other viruses, flu-like viruses that have vaccines. It's the same sort of percentage risk. But once there is widespread vaccination, then the possibility of a community as a whole being infected is greatly reduced. But the risk still remains. The caller is right that in vaccination, the risk still remains for an individual possibly to catch the virus.
Good morning, caller.
Good morning, Blossom.
Morning.
How are you this morning?
I'm good.
I have a question for Mr. Steele.
Yes, go ahead.
Mr. Steele, good morning.
Good morning, caller.
I'm calling from La Colombe. It's almost 3 months now. Well, actually 4 months. It's going on 4 months. The sewage running in the middle of the street, right in front of my house, about 3 or 4 houses behind me. It's getting crazy. Go to Ministry of Health. I go to Ministry of Works. I go to Nawasa. Everybody come in and watch, and that's it. Nawasa say they cannot do nothing about it. It belongs to housing. I go to housing. Housing say they cannot do anything about it. Nawasa have to. That is Nawasa work. I want to know what's going on. It's running in front of my house. I can't even move out. I'm a disabled person, and in front of my house, it smells so stink. I don't know what to say. Inside my house.
Okay. Thank you, caller.
I wish you can help us do something, please. Thank you.
Thank you, caller. Minister?
The individual lives in a housing development.
I just realized I've been talking to my mic muted. The hill going up by the statue, the La Colombe housing project, he has been complaining that the sewage has been overflowing, running in front of his house for the past few months, and it is creating, well, of course it is unhealthy, in addition to the smell and the stench that has been coming from it. He wants to know if there's anything you can do to help him. The Ministry of Housing has not been able to help, neither has Nawasa so far. Can you assist?
He seems to have been speaking to the right people, but he hasn't received that solution. So yes,
he
many
hasn't.
inquiries and try and find out as to why it hasn't been addressed. What's the ultimate issue there? Is it that they're just simply ignoring the gentleman, or there's a larger problem that is going to be fixed, but it hasn't been fixed yet? And because what is described there, I agree, is unacceptable. And what he has said is that he has spoken to the right people.
I would put you on the spot and ask that you help him, please. I remember GBN tackling that story a few months ago, and I was surprised when he called a few weeks ago and said it wasn't fixed. And it's, as he said, going on 4 months, so please, for the sake of the gentleman. There was a question on the Facebook that was asking, is it mandatory, or can somebody refuse to do a PCR test? I'm looking for the exact question, but that was the bottom line. Can somebody refuse to do a PCR test for whatever reason?
Yeah, there are reasons where somebody can refuse to do or may medically say that they can't. Also, for instance, based on age, we don't do PCR tests in general for persons under the age of 5. And depending on certain medical conditions. What would happen in that instance is a person would be required to do the full 14 days quarantine if they were suspected of being exposed or suspected of having COVID-19. They would be required to remain in quarantine isolation for 14 days. So because remember, Blossom, it is possible to keep people in quarantine and not do a test. Once you keep people in quarantine for the 14 days and there are no symptoms, etc., you can give them clearance.
A WhatsApp question concerning the decompressing chamber at St. Augustine Medical Station. 1, is it government owned? And 2, why is it people who go there to be decompressed have to pay $10,000 to get treated?
This is a partnership in terms of it is not government owned. It is St. Augustine that has worked with government in terms of government giving concessions for it, so that to make sure that the service is available on island. The service does come at a price. I think what we need to ensure is that there's certain individuals based on their work that they are at risk for needing that, divers in particular. And we need to have the employers and divers have an insurance, health insurance, if anything, particularly for the bends and the treatment of the bends. Now, that's not the only thing that the hyperbaric chamber is used for. But I think that is where we see in most instances the emergency need for it, but also the individual being put under significant financial stress to pay for the service. So I think instead we need to get to that. They need to be making contributions to a health plan, a health insurance, a national health insurance would cover that, but individuals have to contribute to that. And in the interim, I think divers can get a policy or make a contribution to a health insurance to get them covered for the hyperbaric treatment. It is an expensive treatment. It is an expensive bit of machinery. It is necessary, I think, and life-saving for them. So I think collectively, we need to recognize that and collectively participate in that. So employers of divers and divers need to have that health insurance in the interim. National health insurance should have some element catering for that, but it doesn't change the fact that it costs almost $10,000 for treatment.
Good morning, caller.
Good morning, Citizen Welsh. Greetings and greetings to your guest, Mr. Steele.
Morning, Citizen Rollo.
As it relates to the unsanitary conditions existing in the village of Simon Bolivar in La Colombe, this is not something that started 3 months ago. Now, may I say that I am not quite certain if what the gentleman has been complaining about for 3 months now is the same, but in that village since 2010, the sewer system is broken. Shit water runs out of the system into the drains, into the river, into the southern mangrove swamps and mangrove plantation, whatever you wish to call it, on the coast of the country. 2010. Gawe, the so-called minister, sub-minister, came up there with a television crew, about 10 television cameras, and made a big setup of nothing has been done. This is beyond what the gentleman is complaining about. 2010, we're talking about 10 years, Mr. Steele. So let's stop making excuses and get these issues corrected. They're beyond excuses today. May I just say no more on the issue? Stop making excuses for your incompetence and ineptitude and your improvisionism.
Thank you, Citizen Rollo.
Have a nice day, will you?
You too. And again, Citizen Rollo, I would urge you to be mindful of your language, please, and thank you.
But I was going to say, he seems to be in one of his moods today. I didn't make any excuses. I said what was reported, I will inquire and find out why it wasn't addressed, that it should be addressed. And yes, in some of, and La Colombe in particular, there have been issues with the housing development that government have tried to offer to the people. Most of these housing developments were in the beginning and continue to be donations made by by various countries to assist us in some of the needs. That doesn't mean that they must be substandard at all. We as a government need to make sure that they are in the best condition possible for our people, and that issues need to be addressed. I'm not escaping from the fact that the issue of sewage in Lackalum that exists now needs to be addressed, and whether it's a long-standing issue or not. Nor does that give Citizen Rolo any excuse to be offensive and go on his usual tirades or so. A problem is a problem. And calling each other names also does not fix the problem, Citizen Rolo.
Agreed. Another question, how will the $2.5 million government receive from the World Bank under the OECS Regional Health Project enhance our COVID-19 response mechanism?
Well, it enhances, it's being used in the COVID-19 response. Now, I'm assuming they're talking specifically to what we received specific for COVID-19. So that is being used, for instance, it's paying for surveillance officer in one case through Pan American Health Organization. It is paying for some of the PPEs. It is paying for the various improvements that we've made at the General Hospital, having a COVID wing. It is going to be paying for some of the ventilators where necessary, although most of the ventilators we've made sure to get them donated, and thankfully most of them have come as donations from SGU in particular, being one of the largest donors for that. But in general, it is used across the board to assist in budgetary support for the expense of dealing with COVID-19. We will make sure that it's not used in any level for salaries or reoccurring expenditure, that it is used in areas where it will have the maximum impact, and then we can keep this sustainable. It's also been used with the purchasing for software for dealing with COVID-19. It's been used for some of the improvements at the border control and so. So those are some of the areas. If I sound vague or so, it's because it has been a lengthy process in terms of approval of what we can use it for, and not just simply anything COVID related. So we've been going through that process with the World Bank and making sure that we dot all the I's and cross all the T's with it.
A WhatsApp question. The St. George's Market is again back to its dirty, unsightly state. The authorities are not enforcing the law. The police are worse than the lawbreakers. How can we continue to keep the markets clean following the cleanup? The old tables are back, vendors blocking up sidewalks.
Okay. I think obviously if the caller is right and the St. George's Market is back in a deplorable state, we have to look at the fact that maybe the model that we're using for the St. George's Market is not working, and have a dialogue with the vendors, the people of the town of St. George, and other stakeholders as to what new model we should look at. Quite possibly we have to contemplate that.
There are viewers on the Facebook who are concerned that a lot of the promises made for the sister isles are not coming through, and that is in response to the question I asked earlier in relation to the ventilator and the x-ray. They are saying we are promising things for Carriacou and nothing is taking place. What guarantee can you see that it's not just lip service?
But the work is going on right now. In fact, people have called to complain because we've had to relocate the health center because the refurbishment of the health center has started. And anybody in Carriacou can go and inform the caller on Facebook that there's work going on at Princess Royal. There is work going on at Princess Royal. And as soon as that work is finished, the x-ray machine will be commissioned. The x-ray machine has been ordered, is on island, not soon to come or so, is here. So once the work is finished at Princess Royal, and it's undeniable that the work is going on now. So I think the caller is being a bit mischievous in saying that they haven't seen and they haven't been able to get an X-ray in Carriacou as yet. And the caller needs to be really realistic and honest with themselves and the people of Carriacou, that an X-ray machine just cannot be put into any room and switched on to have X-rays done. But that we have always said that Carriacou will get an X-ray, and we have always said that there are refurbishment work and improvement work to be done at Princess Royal in Carriacou, and that they would get their X-ray after that. The refurbishment work has started. It is being done right now, and as soon as it's finished, the X-ray will be commissioned. So it's not a case of breaking promises or not delivering on what we said. We are delivering. I think the caller would like us to have the ability to just snap our fingers and make it happen. And if we had that ability, we would, and I'm sure the caller would still find another way of complaining about something. But the caller needs to be realistic and honest, or the person on social media. Work is going on now for that.
Somebody is asking if if there are any vacancies for health wardens.
If anybody is interested, please apply to the Ministry of Health. There are vacancies. For instance, we just said we were going to increase the numbers in Petit Martinique. So if there's anybody in Petit Martinique, but there are other areas. We keep getting more and more responsibilities that we have to take on for more and more threats. We now have to have wardens going around to stop people from having illegal parties or gatherings, and so where people just won't decide for themselves not to, and to keep themselves safe. So yes, if somebody is interested in being a warden or being employed with the Ministry of Health in general, please submit an application to the Ministry of Health, second floor, to the Permanent Secretary's office.
And final question, last week, Friday, when we announced the last set of positive cases, at that time we had 11 active COVID-19 cases. Has anyone been declared medically cleared since then? Do we still have 11 active COVID-19 cases?
We are down. We have, I think since then, 2 or 4 individuals have been medically cleared. I will have the CMO and Ministry of Health make that release today in terms of the total number. What we are working on to hopefully launch today or tomorrow at the same time would be a dashboard on our website that would keep you constantly updated so that you won't have to wait for a press release or a press update or so. It would be real time in terms of total number of cases, total number of imported cases, total number of recovered cases, and there would be that space if necessary, and hopefully will never be filled, a total number of deaths, to follow the same stats that other countries have, which we give them, but I would like it to be real time now for all members of the public to see.
Okay, this is the last question. I'm asking because it's something that crossed my mind. With the new regulations for the 72-hour PCR test required before travel, the person is asking if the 72-hour time frame is used as a deterrent for less people to come to Grenada.
No, it is not, and we plainly said, and it's not just us, it's other OECS countries and CARICOM countries as well that have said it, and other countries in the world. If you get a test 7 days before travel that says you're negative, you have 7 days in which you could be infected. And the risk is greater of you arriving here in Grenada still infected, although you have a negative test that's 7 days old. But if you have a negative test that's 3 days old, you only have 3 days risk of exposure. So what we're trying to do is to reduce the risk of somebody coming to Grenada with COVID-19, unbeknownst to them as well. So I mean, if the flights are still there. The flights that have stopped since we reopened have stopped because the other governments in Canada or in the UK or so have curtailed the movement of their own citizens. And as such, the volume just isn't there for Air Canada in certain instances to come as frequently as we would like them to come or that they would like to come. With British Airways and Virgin, it is the British government that has stopped non-essential travel during their lockdown period. All we have done is increase the level of diligence that we have in terms of screening individuals who would like to come to Grenada. I know that this has caused some inconvenience to individuals in terms of them now having to get a test within 3 days of travel as opposed to within 7 days of travel. But please understand that it is necessary in order for us to keep Grenada as safe as possible and still be able to welcome you home.
Minister Steele, thank you so much for sharing some information, additional information for us as always. Always a pleasure. Thank you so much for being our guest this morning.
Blossom, thank you, and it's always a pleasure to be with you and to get the questions from and comments from your viewers and listeners. It helps us to adjust, adapt, accommodate, and fix problems.
Appreciate it. Thank you. Continue to stay safe and COVID-19 smart. Appreciate it.
You too. Be safe, wear your mask, keep your physical distance.
Definitely will.
Have a wonderful Christmas, but I do think and hope that I'll be back on your program again between now and then.
Of course, of course. Always a space for you. Thank you so much. Have a good one. Minister of Health Nickolas Steele, our guest this morning. We thank him. I know there are still questions on the WhatsApp that I haven't gotten to as yet, but with the interest of time, which I have already stolen 2 minutes out of Christmas Caravan, definitely when he gets back, hopefully we can get back to some of these questions. Thank you guys so much for tuning in to The Point. That's the end of my time today. Janelle and Joseph are up next with the Christmas Caravan. I'll be back with you tomorrow, God willing. Have a productive Wednesday.